Well, my goodness, thank you. I don't know what I could possibly say that could follow that. By the way, one of the disadvantages of having my sons here is they promised me if I droned on too long, they would just stand up and start applauding. So if you see anybody over there doing that, you know what's happening. I would thank you. I am very honored and very humbled to be up here, especially with that incredible introduction. I need a copy to send to my kindly 92-year-old mother. I want to thank everybody associated with Results. I want to thank, of course, Joanne and all the organizers of this particular event. I also very much want to thank all of you. I'm lucky. I'm a pediatrician. I get to deal with kids every day. And I get to see every day the effects of all the efforts of what everybody does. And I so admire, and I said this, Bob's heard me say this at Children at Risk so much, I so admire our board members and folks with Results who don't get the feedback every day of seeing how what they do actually directly affects the lives of children. And I have that privilege to do that. And it's been a privilege to work with Results and help write some pamphlets and go to Washington. And I think I've learned much more from them than they have learned from me. A lot of things that I've taken forward and other efforts I'm doing. I want to start by telling you about a patient. And this patient's name is London Nguyen, and he is a little Vietnamese child. And when London was about a year of age, he started getting sick. And he had symptoms that kind of sounded like the flu. He was coughing, didn't feel good, wasn't quite acting right, except it got worse and worse and worse. And then eventually he got extraordinarily sick. And it turned out that London had tuberculosis, but he had tuberculosis meningitis. He had TB that had left the lungs and actually involved the area of and around his brain. And even worse than that, he had the form called multi-drug resistant tuberculosis, which means the standard anti-tuberculosis medications didn't work very well. This is a story that we're hearing now all over the world. At least 1 million people in the world every year get struck down by this multi-drug resistant TB. The problem is that London lives in El Paso, Texas. And we helped take care of him at Texas Children's Hospital in Houston. And London is a great illustration about how small the world has become and how global, in fact, everything is. In my little over 25 years, I think I've taken care now of about 1,000 children with tuberculosis disease. And I hate to tell you this, and I'm honored by everything Joanne said, but I have to ask the question, what does it say about us, about Houston, about Texas, that I became a world expert in tuberculosis in Houston, Texas? And that's just one thing I want you to think about a little bit as we're going forward here. Andrea Cruz, who's one of my colleagues, is here tonight, and she and I just wrote an editorial in Pediatrics. 75% of the children in the United States who develop tuberculosis have some kind of international connection, either for themselves or from their parent or who they actually acquired tuberculosis from. The world is getting to be a very small place. And if we think that the problems that we perceive as being in the rest of the world are not going to directly affect us here in our comfortable homes in Houston, then we are really terribly, terribly sorely mistaken. I've had some wonderful experiences in my life. I've really been extraordinarily privileged. And one of them has been the ability to go other places in the world and see what happens, go around and learn, hopefully help, and to teach. Baylor College of Medicine runs a series of pediatric AIDS clinics in Africa, and Andrea and I have been privileged to go there and try to help take care of those kids with tuberculosis and HIV as well. You know, TB now is a disease that affects almost 10 million people a year get the disease. 1 to 2 million people die. And it's estimated that almost 10 million children in the world have been orphaned by tuberculosis. Yet this is a disease that sort of the average person doesn't know about, thinks has gone away, but it's clearly one of the leading killers of people in the world and one of the leading killers, unfortunately, of children. And the real tragedy is not only is it a curable disease, but it's actually a completely preventable disease. And in fact, the title of our editorial is Childhood TB, a Preventable Disease That Is Not Being Prevented. And that is certainly true in the world, but unfortunately it's also true in the United States. So I just want to tell you a little bit about sort of how I got up here, my history. I just started out as a regular pediatric infectious disease person, and back in the 1980s, I was on service at Texas Children's, taking care of children as inpatients. and had a pretty tough month. I had a child who actually died of tuberculosis. I had a child who died of AIDS. It was in the middle of the measles epidemic that occurred back then, and we had several children who died. So what does any physician do when they have a month like this? I wrote an editorial in the newspaper. Of course, that's what any doctor would do, right? And what I wrote about was kind of how, in the shadow of arguably the best medical center in the world, the Texas Medical Center, how could these things be happening? What's wrong? There's something wrong here. These are all preventable things, yet they're happening and happening all the time. And so several of my colleagues and I got together and decided that we wanted to try to address some of these issues. And we actually gave ourselves a name, kind of a silly name, called Medical Advocates for Children's Health. Now I gotta tell you, this is an organization that never existed. There is no record of it. It had never paid any taxes or never had a 501c3. We just got together and gave ourselves a name. And in talking to some of the local politicians, we were given the privilege actually of reviewing the city health department budget and trying to help them decide if money was being spent properly. And the example I always remember is that there was a program back then, some of you may remember it, called Baby Buddies. And this was a program by the March of Dimes, and that's back when everyone was talking about public-private partnerships. And they were partnering with the city, and the idea was to link a young girl or woman who was pregnant with an older woman who could help get her through pregnancy, delivery, and so forth, and also try to prevent what we call recidivism, the girl or woman having additional children rapidly thereafter. The program was wildly successful, and the deal was that the March of Dimes would pay for it for the first 3 years, and then the city would take it over. Well, the March of Dimes paid for it for 4 years, and then said to the city, okay, it's time for you to take it over. And the city said, no, we won't do it. We can't do it. We don't have money in the budget. Can't do it. So we, little group called Medical Advocates for Children's Health, heard about this, and so we went and talked with the controller of the city. And we said, you can't do this. You can't not pay for this program. And he said, why not? And we said, because every single not-for-profit in the city is watching you right now. And if you don't follow through on your promise, when you go to them for something, they're all going to tell you to go to hell. That's exactly what we said. It was back in the budget the next day. And I have sit up in my office an award that was given to an organization that doesn't exist. It's actually an award, it says right on it, to Medical Advocates for Children's Health for helping out with this particular program. And I learned several things from this. One of them is that perception is reality. But what I really learned is what individuals or very small groups of individuals can actually do and how much they can accomplish by learning a little bit, putting their minds to it, which by the way, is the absolute mantra of the Results Organization, is exactly that. That's what grassroots is all about, is people becoming interested, knowing a little about something, and going and trying to wield their influence. In essence, giving people an offer that they can't refuse. So after I did this, I also got to know a few people. I kind of joke it was a bunch of social workers and me, and there was actually a meeting that was held that was called Children at Risk. And it was a meeting to talk about children. And back then, nobody was talking about children. And what we realized was nobody knew anything about children. There was no database. There was no information. So there was nothing for people to act on because they didn't even know what the problems were. And so to make a very long story short, that was the seed out of which the organization Children at Risk was born. And I tell people that other than my family, the thing in my life I'm proudest of is being involved in Children at Risk and what that organization's been able to accomplish over the last 23, 24 years. But again, just a small little band of merry warriors who got together and had an idea and just by sheer will got things to get going. And that's one of the sort of lessons that I think that I want to tell everybody about. If my being up here means anything, that's what it means. I'm just a pediatrician. So we heard about the child survival meeting that occurred. I was fortunate to be invited to go to the child survival meeting in Washington this past June. 700 people from 80 countries. One of the keynote speakers was Hillary Clinton. It was sponsored by the governments of the United States, Ethiopia, and India. For me, it was almost a sort of life-changing event. It was one of those things that I don't think I've ever learned more in a 2-day period of time. But it made me literally see the world differently. and that's a pretty remarkable experience. What are called Millennium Development Goals have been set, and the goal for 2015, one of the goals, is about child survival and trying to increase child survival, decrease child mortality, and that's what this was all about. So I don't want to give you too many numbers tonight, but just a few. I've been talking about 5 minutes. So what's gone on in the world in the last 5 minutes? Well, 3 women have died from complications of pregnancy and delivery. And another 60 women have developed some kind of debilitating injury or infection in association with exactly the same thing. 70 children have died in the last 5 minutes, 30 of them newborns. And that doesn't even count the ones that were born premature and so forth. That's the order of magnitude of the things that we're talking about, even with the improvements that Joanne has mentioned. And the saddest thing about this is almost all these things are preventable. They're absolutely preventable. They simply don't have to happen with very small number of resources, but proper attention paid to them in the organization. What are the major causes of childhood death now? We've heard this. In 1990, there were 12 million childhood deaths. That's down to 7.6 million now. That's wonderful. That's a wonderful decrease. But listen to what people are dying of. These are what these kids die of. Prematurity. You've heard about pneumonia and diarrhea. 2 million children a year die of pneumonia and diarrhea still in the world. Malnutrition, malaria, TB, HIV. That's what's killing most of the kids in the world. And vaccine-preventable diseases, although we're doing much better with that, I must say. So the other thing I learned from this conference, and this, in retrospect, sounds so obvious, but there was a wonderful presentation by an epidemiologist from Sweden who does these amazing graphs. I can't even begin to describe what they're like. But he has incontrovertible data that show that when children survive, families have fewer children. Their income goes up, and the amount of resources that the government has to spend goes down. And so many of these things are tied together about child survival. Increasing child survival actually lowers the rate of poverty. And I know many people that seems counterintuitive at first, but they're actually, when more child survive, there are fewer children, and poverty goes away, or certainly improves. And we know this to be the case. And we also know that so much of the health of the children is tied up in the health of the mother. And the big push now internationally is what's called integration of programs and trying to keep families and family-centered care. And this is one of the things we're really emphasizing in TB now is family-centered care. No longer just looking at an individual person or a child or a mother. Hey, the whole family's in this together. And if we don't approach it that way, we're never going to get anywhere. There's tons of good news about all this, and Joanne alluded to much of this. The rate of decline in childhood death is actually increasing, or that is the rate of survival is actually increasing. And the phrase we heard over and over and over again is the phrase, bend the curve. The curve is going up for survival, but we have to bend that curve to make it go up even better and even faster. About 80% of the children now are getting vaccines in the world. That's better than many areas of Texas and Houston, by the way. I'm going to let that one sink in for a minute. We do better vaccinating poor kids in many poor countries than we do vaccinating kids in Texas and in Houston. There's now something as simple as the widespread distribution of mosquito nets. Malaria was killing 1 million children a year. Children are the ones who die from malaria, get very severe disease. And by the very simple distribution of millions of mosquito nets, hundreds of thousands of children's lives have been saved every single year. And the cost of mosquito nets is literally pennies to $1 or $2. So incredible successes. And the most inspirational talk I heard at this meeting was from the Minister of Health in Ethiopia. Now, when you hear the word Ethiopia, what do you think about? Most people think about poverty, misery, malnutrition, late-night television. But that's not what you should be thinking about, because here's some of the statistics. In the last 15 years, they've lowered child mortality in Ethiopia by 42%. They've lowered maternal mortality by 73%. And their immunization rate now is between 85 and 90%. Simply by effort, organization, and some help from some of the richer nations in the world to support these particular efforts. So there's every reason in the world to be hopeful. This is all something we can do something about. The quote from the Minister of Ethiopia was, quote, slow progress is no longer an option. Progress does not equal success. And that's exactly the attitude that we need to do if we're going to bend that curve. It's not good enough to just make slow progress. We got to do better. We have to have success. Some of the lessons I think I learned from this conference: incomes across the board are worse than poverty. Childhood illness causes family poverty, and family poverty causes childhood illness. The two are completely linked together, cannot be separated. Maternal health and education is absolutely the key to child survival. There's, again, incontrovertible evidence of that. Most of the problems that we're facing require very simple, very inexpensive fixes to occur. And the most important element, and the element that's almost always missing when things don't go well, is political will. And that, if you talk to people from WHO when they're talking about fixing health problems, they will tell you it starts with political will. And this is what the health minister and prime minister of Ethiopia had, was the political will to say this is no longer acceptable. We simply will not let this happen anymore. So what about us here locally? Obviously, poverty in the United States is a little bit different than poverty in other parts of the world, but it still has incredible ramifications for children. For about 13 years, I was the chief of pediatrics at Ben Taub Hospital, where we deal with a lot of uninsured children. And I think we need to remind ourselves that in Texas, about 30% of children are uninsured, and Harris County has the highest number of uninsured children of any county in the United States. Let me say that one more time. Harris County, our county, has the highest number of uninsured children of any county in the United States. And we have permitted that to happen. This and many other local issues, of course, is exactly what Children at Risk is trying to address and trying to help our elected officials and other agencies address. Children at Risk is coming out with its semi-annual report in a few weeks. So I just want to read you a couple statistics about poverty in Houston and in Texas. 48% of Texas children, almost half of Texas children, live in low-income families, and 26%, a quarter of them, live below the federal poverty level. 1/4 of all children in Texas live in poverty. 85% of those families, by the way, have at least one parent that's working. These are the working poor, and this is the predominant population that occurs in Houston and in Texas. In Harris County alone, there's 312,000 children who live in low-income or poverty families. And this is where these things all link together. 86% of low-income and 53% of poor children have parents who did not graduate from high school. And our current high school dropout rate is, Bob? 46%. Say again? 46%. So children who have parents who didn't graduate from high school are almost destined to live in low income and live in poverty. And I think it's quite obvious what the ramifications of that are for health, survival, all kinds of different things. The other thing I want to point out is the level of help that people are getting. There's a program in Texas, many states, called Temporary Assistance for Needy Families, or TANF. This is what many people would refer to as welfare. One of the things I love to do is kind of address myths and address things that people think. So you hear a lot about welfare and whether people should be on welfare and so on and so forth. In Texas, less than 3% of the children who live below the poverty level get this kind of assistance, and 88% of their applications are rejected. And you know how much money a child gets for this, for so-called welfare? $71 a month. That's all. $71 a month. And we're not even providing that to the majority of families and children who live in poverty in Texas. So the only point I'm trying to make is these are not problems that just exist in Ethiopia. These are not problems that just exist in other areas of the world. These are problems that exist in our own backyard. So, however, I'm actually very, very hopeful. And I think, as Joanne said, we're living at a really good time. In March of this year, I gave a talk at the CDC, World TB Day. The theme this year was childhood TB for the first time ever. And I was very honored to be invited to give this talk at the Centers for Disease Control. And the title of my talk was Childhood TB, Are We at the Tipping Point? And that's based on the book by Malcolm Gladwell about tipping points, social problems, and so forth. And I tried to construct the argument why I thought we absolutely were at the tipping point, because there had been a lot of people coming together with new efforts and new resources and new energy. And I truly think for my world, childhood tuberculosis, we're on the precipice of doing some really wonderful things and really knocking down the rates of disease and keeping a lot of children alive and much more healthy. So the question I would ask is, for these childhood problems, specifically child survival, are we at the tipping point for that as well? And I agree with Joanne. I think that we are. I think we know exactly what to do. I think we know exactly what it's going to cost. And I think the issue, and probably the only issue, is going to be whether or not we have the political will to make it happen. I was asked to give a quote as sort of one of the promos for this night. And I'm going to read what I said because it's what I really believe. Millions of the children in the world continue to die each year from preventable diseases and conditions. We have the tools and the resources to attack these problems now. What we have lacked is the political will to do so. Future generations will judge us by whether or not we dedicate ourselves to the achievable goal of helping children survive and thrive. So, what is each one of us going to do? I always like the words of Margaret Mead, the very famous anthropologist who said, "Never doubt that a small group of thoughtful, committed people can change the world. Indeed, it's the only thing that ever has." And I think that's absolutely true, and results. This organization is an absolute testament to how individuals and small groups of people can have enormous impacts on literally changing the world, even the world that they never see and that they never directly live in. I'm going to end with a quote that I heard at the Childhood Summit that's become one of my favorite quotes, and that is, "People who say, 'What can I do?' usually do nothing. People who say, 'What else can I do?' usually do much." All of you, by being here tonight, have already done something. And I hope we all ask ourselves the question, what else can I do?